Hello, hi, everyone who's joining now. We're going to get started in just a couple minutes. I'm just going to bring things up and glad to have a lot of folks already. Hello again to anyone who's joining. We're going to start in just a minute. I'm just getting everything set up and giving, a little bit of time for anyone who might be running a tad late. Whoops. Great. Okay, let's see, it's 12:02, so we better get started. Welcome everybody. My name is Dr. William Benson. I'm a staff psychologist here at CBT DBT Associates, and I'm going to be leading this webinar today on reversing habits, reducing hair pulling, skin picking, nail biting, and related behaviors. Just a few housekeeping points before we get started. So one is that just a reminder that the webinar is being recorded, so keep that in mind. You certainly don't have to turn on your screen, but you can do so if you would wish. But just understand that this is being recorded. We're going to have this sort of for us to use archivally. Other people might be able to access it if they want to kind of learn the information but weren't able to attend. So just keep that in mind. Also, there are a lot of people on, which I'm excited about. Thank you so much for taking maybe your lunch hour or any hour during the day to join me. But there's several people on, so I'm anticipating that questions might come up about maybe specific things for you that might not sound exactly like the general things I'm talking about. And so I just want you to keep in mind that if you do ask questions, it's great, but just keep in mind that, it's not totally confidential. It's not like a therapy session. So if there's any question you don't feel comfortable asking in front of the group, at the end, I will give my email address, and the slides are going to be sent out to those of you who are in attendance. So you should get those. And you can feel free to email me after the presentation with those types of questions. That you also will notice that everybody is muted coming on to the chat. Please, stay muted throughout. That's just going to make it easier. If you do have questions, I think the best way to ask questions is through the chat, and I'll try to kind of keep an eye on those, but I'll definitely want to come back to questions at the end, but you can ask them anytime throughout the chat. If you really have, for any reason, it's difficult for you to use the chat feature, but you have an important question toward the end, you can use the feature to kind of raise your hand or to notify me, and I can unmute you to ask the question if we need to do that. Also, just because I don't have a producer or anybody else helping me out here, so I would like if people could sort of reserve the chat function for questions. So in most situations, I love comments like cheerleading and this is so helpful and that's great, which is wonderful. And at the end, feel free to kind of put those in, but it may make it harder to find questions you know, if we could just kind of use the chat for questions, that'll make it easier for me to make so that I can see all the questions that come in and answer as many as I have time for. I see the initial question is, how long is the webinar? So the time allotted for this is an hour, supposed to be over at 1. However, I don't have anything immediately after this. So if there are several questions, we may go over by a little bit. I understand not everybody will be able to do that. And, you know, like I said, the slides will be sent to everyone. I'll try to get through all of the main material by 1 so that anybody who does have to leave then, because you just, you know, you have an hour for lunch or whatnot, that you can get all the material. If you have to leave before that, that's totally understandable. Feel free to just leave whenever you need to, and know that you'll get the slides sent to you. And if your question wasn't answered in the part that you were able to participate in, you can email me afterwards. Please feel free. I'm happy to receive those emails and answer any that I can. Okay, so why don't we go ahead and get started here, because we do have a lot to go through. So in the goals of this webinar, I really want us to understand the behaviors that we're talking about, and the sort of term that there's a definition for on the next slide, but is body-focused repetitive behaviors, which is a little bit of a mouthful, but sometimes it's easier than just like listing a bunch of behaviors and saying they're related, which I did for the title. BFRB is the initialism or abbreviation. If that is helpful for you, it's a little bit jargony, but sometimes it's faster to say. So those are the kinds of things we're talking about, but I'll try to kind of use language that is like giving examples rather than just using this term as much as I can, so that people understand what I'm talking about. I want to be able to talk about some helpful strategies for changing these behaviors, for reducing them. However, this is only an hour, and you know, it can be somewhat complex. So this is an overview, and this is to give you some tips. And I do have some resources if people want to look into more on their own. But I don't want people to expect that after this webinar, they're going to be able to, if you have a really significant difficulty not being able to stop some of these behaviors that we're talking about, I don't want you to expect that after an hour, you should know everything that goes with this way of doing it, and that therefore if you can't, you know, if it doesn't work what you're doing, then this whole thing doesn't work and I'm, you know, a con artist or that sort of thing. It's a little complex. So this is an overview, and hopefully it will be helpful, and it will also give you some resources to get more information and continue with this if this is something that you struggle with and have difficulty with. So therefore, yeah, I'm going to talk about when do I think like professional treatment, when does it really make sense to have somebody who's trained in this, like I am, work with you either individually or, you know, in a group or something like that in a more ongoing way. And I'm going to discuss what that treatment would look like to help you, you know, if you're anxious about seeking that type of treatment, to maybe help alleviate some of the like uncertainty around that. But also so that you know, because there's a lot of treatments that are offered for lots of different things, but for this, you know, as an example, that are not necessarily likely to be effective. They don't have any scientific backing or any research to show they're effective. And that would be really unfortunate if you were doing that, if you were spending your money and time doing something that's not likely to work, when there are things out there that are more proven. So I want to give you an idea of what those things are and what they look like. So body-focused repetitive behaviors. So really the definition here is helpful because they can be a lot of different things. So acts that involve repeatedly touching the body, basically. And then they're problematic because, you know, we're specifically talking about when they can cause damage, like visible hair loss or bleeding or scarring or things like that, or really significantly interfere in your life or your quality of life. So again, you know, some common behaviors that kind of are related and fall into this category, although they're not always problematic if they're not happening that much are like nail biting. You know, I mean, so many people bite their nails. So if you bite your nails, you know, you're in good company, right? There's a lot of people who do that. And most of the time it's not a big problem, you know, and certainly like people biting their lip again, or biting the inside of your cheek, you know, really, really common and not always a problem. But they can be problems when they happen to such a degree, right, that it's causing damage, that you're experiencing a lot of pain or infections or, you know, scarring, or, you know, it's really interfering with your life, right? And then the things that are more common, that are, you know, not as common as maybe those behaviors happening to a small degree, but are more common in terms of what we tend to see as problems where people come into treatment are hair pulling, so pulling out hair from the head or from other places on the body. Eyebrows, eyelashes are not uncommon, other body hair. And then picking at the skin, so usually a spot in the skin that seems uneven or like a skin tag or something, and sort of picking at it until typically it bleeds or you've sort of removed that spot, but it's caused sort of a gouge or welt in the skin that results in, you know, visible marks that can be really concerning to people, and then scarring and things like that, right? Biting the nails, I already mentioned, to a degree that it's causing damage, or biting the lips in the same way. The other thing that would be considered skin picking, but, you know, sometimes there's a picture here, the person with the chapped lips, sometimes people are picking at sort of the chapped places on their lips repeatedly until that causes a lot of irritation, even bleeding or cracking of the lips due to that. So all of these behaviors are related, and they can be treated in the ways that I'm going to kind of talk about today. It's also important to talk about what we're not talking about. By the way, if you see me looking to the right, that's where my best clock is. So if I keep looking over here, it's just because I'm trying to make sure I'm conscious of the time. So it's really important just to distinguish this, because different things are treated differently, even though they might look the same. So we have to distinguish between a BFRB, so all these behaviors we're talking about, and like self-injury, which is also sometimes referred to as self-mutilation. Cutting is the most common of these, but anything like that, cutting, burning, or scratching. And the difference here is that in self-injury, the damage is intentional. It's part of the goal. You sort of expect to cause damage, and you sort of want to some degree, even if you don't really want to do the behavior in the long run, but in that moment, you want to. Whereas with BFRBs, the damage is usually sort of a side effect. That's not your main reason, but it ends up causing damage, right? Whereas self-injury, you're sort of trying to cause damage, you know. So if you're self-injuring, then, and I sort of touch on this later, but that's a different thing. And it's also a really urgent thing, and we want you to seek care right away, because it can be related to other things like suicidality, that can be very, very serious and urgent. And, you know, we want to take, you know, an abundance of caution when we're talking about kind of life and death, which that can be, not to scare anybody if you're doing these behaviors to some degree. But I do want to say that I don't want you to just try on your own some of the strategies we're talking about today and feel like that's enough. I do want you to seek care from a licensed professional, talk to your doctor about a referral. We're also not talking about tics. So sometimes people will call, like, a habit of people are biting their nails, they'll call it a nervous tic. And this is why I just want to distinguish. So tics are generally involuntary, rapid, automatic looking behaviors like eye blinking or things with the eyes like that, jerks of muscles, things like that. Sometimes tics can look like more kind of complex behaviors and could involve like touching some part of the body with another part of the body. But generally, if that behavior is a tic, you'll have had some history of the more kind of automatic or simple tics in the past, the just like eye blinking or muscle jerks or something like that. And this will feel very similar to that. There'll be an urge to do it that's physical, that's almost like having to cough or sneeze. You know, it's almost impossible to control, or you can control it with just a huge amount of difficulty. That there's a relief immediately after doing it that feels like a physical relief, and that's different. Now, people can have both tics and these behaviors, and there can be situations where it's hard to tell the difference. But if you're having difficulty determining that, that's a good thing also to kind of talk with a professional who knows about both areas and who knows about tics, who can help you decide what the best treatment strategies are. That also reminds me to say, for self-injury, if you're not sure, because sometimes there can be a little bit of a gray area or a thin line. If you're not sure if something might be self-injury, then you definitely want to play it safe and seek a professional and kind of have them help you determine that. If you had a question like that, you could also ask, or if that was sensitive for you, which would be understandable, you can email me about that. But definitely, if you're not sure at all, it would be good to kind of treat it as self-injury until you know it's different, so that again, you can kind of make sure that you're safe. It's also important to understand that what we're talking about isn't just anxiety or stress. So again, nervous tic, people might call it, or people might say, like, it's kind of just a manifestation of anxiety. Like, you must be a very anxious person because you bite your nails, right? So people hear that a lot, and they can be related. So sometimes people can bite their nails more or pull hair more when they're stressed out, when they're feeling a lot of anxiety about something. But not everybody. Some people do it more when they're feeling good and they're bored and they're at home. We'll talk about different kinds of situations. And it's definitely not a one-to-one relationship. And a really important aspect to know is that if you go to treatment for anxiety and someone says, well, I think a therapist says, I think you're an anxious person, so we're going to treat the anxiety. That might be great, but don't expect that just because your anxiety goes down, that this behavior is going to go away, because it's not a one-to-one relationship. The same thing with medication. Sometimes people will get medications for anxiety or depression, and what they want is for them to do these behaviors less, and that doesn't usually happen. There's not great research that shows that connection. So we really need to directly treat the hair pulling, the skin picking, whatever that behavior is. And we may need to treat anxiety too, because being anxious sucks, for lack of a better word. And, that decreases your quality of life. But again, don't expect it to necessarily significantly reduce pulling or picking or these other behaviors. And then, of course, we need to distinguish between, when it comes to hair pulling, there's other conditions that cause hair loss, right? Like, women and men can have thinning of hair as they get older. It's just age related, and sort of pattern baldness, male or female pattern baldness, right? That can happen. And there can be other conditions like alopecia, where people are losing their hair at a younger age, and sometimes people might kind of might see something on TV related to hair pulling, which is also called trichotillomania. People might know that, and think that that's what's going on, because sometimes people will like comb or brush their hair repeatedly, or rub over a particular spot until they lose a lot of hair. And that can be a way that people pull hair. But typically, if you're just brushing your hair a normal amount, the amount you've always done it, you run your finger through your hair every once in a while, and a bunch of hairs come out in your hand, you're probably not pulling those out, right? They're probably falling out. They're probably loosened due to hair loss. And so the rubbing and then having them in their hand is just your sort of evidence that the hair is thinning, rather than you're pulling them out. So I just want to distinguish those two, because that, of course, you want to talk to a medical doctor about any issues related to hair loss, and if there's any treatments that you want to do there, or some, except for those of us getting older. I have a little bit of hair loss, and luckily you can't see on the webinar screen, but I'm just trying to practice acceptance through that, but just to understand those differences there. Okay? Good. Maybe I'm making sense because I don't see a ton of questions. So I hope that means that everything I'm saying is like crystal clear, which would be wonderful. It might be a first for me, but hopefully that's the case. Please do ask questions in the chat if you have them. This is just a little bit of a comic that kind of goes into the causes. So, you know, one person is saying behavioral genetics isn't a real science. You know, the human brain is too plastic, it changes, you know. The true science of mind is empirical psychology. I reject the notion that a child's future self can be predetermined by a string of nucleotides. The other person says, precisely, we must return to the correct paradigm of blaming mothers for all psychological disorders. And the first person says, why are they always too affectionate or too cold? So whether this was a laugh or a groaner for you, I think it kind of illustrates a point that of this nature-nurture debate and in the history of psychology, things that have been talked about, so that people pulled their hair because, you know, they were stressed out because they didn't get enough love or things like that, right? Definitely not the case. And there are some biological elements here that research supports. There's definitely a genetic link where people are more likely, if they have relatives who have engaged in similar behaviors, they're more likely to do it, even if they didn't grow up with those relatives. So there is an amount that appears to be genetic, but it's not completely explained by genes, and certainly it can change based on the experiences that you have, based on kind of what you might try and whether it is in some ways helpful, because in some ways these behaviors, they serve some function that we're going to talk about, and there's a reason why you do them. But, you know, the side effects of doing them, that damage and things like that, right, they might be worse, and it's not worth it, and yet you have difficulty stopping. So there's a lot of complex factors. There definitely is a genetic thing that makes some people more predisposed to getting into this habit than other people. And then there's situations that are different in people's lives that happen. From an evolutionary standpoint, you know, there is a lot of evidence that supports the idea that this is kind of grooming behavior that is gone a little bit on overdrive. So, you know, if we think about it, we all, of course, brushing and combing our hair, we clip our nails, right, with clippers or scissors. You know, we might pluck we might pluck our eyebrows or whatever, right? So that's really common. And in other animals, you see grooming behaviors, right? Chimpanzees are picking bugs off themselves, off each other, right? Cats that bathe themselves with their tongue, right? So grooming behavior is something that happens in a lot of different animals. And what we think is an area of the brain that is really involved with that can be overactive, or it's kind of not like quieted down enough by areas of the brain that are more involved in conscious and planful kind of behavior. So, you know, it's a little bit on overdrive. And so it wants us to do some of these preening and pruning things, and then the particular behaviors that we have are a manifestation of that. And it makes sense. The other thing to me that supports a biological component of it to a degree, I mean, everything that's a behavior is also biological. Like there's some biology that you can point to, activity in the brain, and all activity in the brain can have, you know, some sort of external manifestation of it, right? Like behavior. So if we change behavior, we can change biology and vice versa. But these behaviors do get very ingrained in some ways. And for some people, if you're doing this for a long time, you do it a lot, you do it frequently, it can be hard to completely eliminate, even if you can reduce it. Though reducing it can be really helpful. You know, I don't mean to be pessimistic, but it can sometimes be really challenging for people who really have do this frequently and do it a lot. And that points to an idea that it's a process that is kind of deeply ingrained, and it's related to other common behaviors. So that's just to also take away blame or shame or stigma. If you feel like, you know, you lack self-control and that's why you can't do it, that's really not it. You know, it really does seem to be this kind of deep-seated behavior that your brain is thinking this is important for survival. You know, grooming is all about being safe and being able to be clean so that you're not getting infections. So, and, you know, so that you're able to stay warm and, you know, all of these things like that. And that's really important to survival. So, you know, it makes sense that they would be hard to change. But we're going to come with some good ways that we can make changes there. So don't fear. Like I said, they can be exacerbated by stress or anxiety. I also mentioned that sometimes it can be boredom or sort of restlessness, needing something to do with your hands, that can be situations where this happens, but those things don't cause the behavior. And we really want to understand a lot of the thoughts that people are experiencing related to this, thoughts about how they look, thoughts about how something feels to them that may influence this behavior, emotions that you feel before, during, and after, and then longer after, are going to be really important to kind of understand what your unique experience is, which could be different than somebody else. So they can have different causes in different people. Sensations can be really important as well. So when you are touching your body or touching your hair, you feel physically different sensations, right? And if you think about like getting a massage, or when you scratch yourself, or when you rub something that feels kind of cool, like, ooh, this is kind of this texture, right? The fabric of you know, sweater that you have that's really soft, right? Those things can be important to us, the reasons why we do certain things, and they can be important here. Touching certain parts of your body in certain ways have certain feelings. Somebody asked about cracking knuckles or neck jaw. So that could be related if you were doing it a lot, and again, it were causing problems, although there's not, you know, you would have to be doing it pretty frequently for it to cause problems in terms of like damage, or maybe doing it in a certain way aggressively to make it happen that might cause damage. But certainly it could get in your way, like annoy, or, you know, if you've been quarantined with a spouse or partner for 4 months, and now when they hear you crack your knuckles, you know, they're about to go like Cell Block Tango from Chicago or something like that, you know, it's going to be their motive for murder or something like that, you know, then that gets in the way in your life, right? So it could, and that sensation, it could be the feeling of it, or the feeling of relief, or the sound of it potentially could be something that you would be important for you. Visual inspection also is really important for these behaviors, looking at what your nails look like, what your hair looks like, seeing something that seems off and wanting to change that just by your perception of it, and understanding that visual perception also does not have a one-to-one ratio to the sort of reality, like the way that we perceive things is somewhat constructed by our minds. So understanding that is important, but that image that comes when we look at something can be an important factor. Okay, so I spent a while talking about causes because that's also really crucially related to some of the most effective ways to treat this. So I'm going to talk about 5 different things here, and related to how you can reduce these behaviors. The first one that's so important is determining, not like using the scientific research of neuroscience, the fMRIs to look at the causes for everyone, but to figure out what are the things for you that seem to be related to specific instances of pulling or picking or whatever this behavior that you do is. Okay, so that means, when do you do it? Particular times of day, particular days, after certain things have happened. Where do you do it? Are you alone? Are you with other people? Are you in the bathroom? Are you on the couch? Are you in the bed when you tend to do it? These are really important to understand where you have to put some factors we're going to talk about later to control some of things. What do you use? Do you use your hands? Do you use tweezers? Again, are you chewing so you're using your mouth? Things like that. Also, like what you're wearing and how you're wearing your hair. Are you wearing it up when you do it? Are you wearing it down? Are you wearing it in a bun? You know, are you wearing long sleeves or short sleeves if you're picking on your arms? You know, things like that are important to think about. Do you have artificial nails on? Do you have your nails polished or colored when you're biting them or not? Is it after you've clipped your nails or when they get longer? Things like this are important to understand. And it's important to be aware of the thoughts, emotions, the visuals, right? The sensations, and to be aware of the specifics of your behavior, what you specifically do, not just I pull my hair, but really the whole sequence that may be unique for you to compare to other people. That's going to be important. And you're going to, just by doing that and monitoring that, which I'm going to show you what that might look like in a second, you may come up with solutions that I am not going to mention here in this webinar. I'm not going to think of. And some of the solutions I say as examples are not going to work for you. And that's why it's really important to know about you. If there's anybody here who's done DBT for other things, this is where we get into kind of like the chain analysis, if this sounds kind of like that. So for those who don't know DBT, don't worry. I just said crazy gibberish. It doesn't matter. But the point is, it's that kind of thing for anyone who, if that's helpful, of really understanding all the things that lead up to this behavior and what the behavior really looks like. Then that allows us to do these three elements here that I'm going to talk about based on what is specific for you. Antecedent control, and it's a little jargony too, but I'll get into that. Replacement behaviors, something called habit reversal. These are the three pillars that have been used for decades to treat this behavior successfully. And then I'm going to talk a little bit about mindfulness, which you may already know some things about, and it's helpful for a lot of things. Mindfulness in and of itself is not like, if I just do some meditation, then like my picking will go away. Definitely not saying that at all, but it can be helpful to kind of enhance and make you better at some of these other features and maybe reduce overall difficulty with tolerating some difficult emotions or urges that are hard not to act on. Mindfulness can help with that. So it's a good sort of adjunct to these other things. So this is the something I sort of alluded to earlier. I said we're going to talk about how you might monitor what's going on for you. So this is a form, and it's from a book that is a resource later on in a later slide that I'm going to give to you. But it's what's called a self-monitoring form. So you're monitoring this behavior yourself. You don't have to use this form, although it will be available in the slides because I'll send you the slides. But you could do this on your phone, in a note, or a tablet computer, an Excel spreadsheet, whatever is best for you. And it doesn't have to look exactly like this. There are different versions of this. But I want to point you to some of the key features. So one is, this is being tracked over specific time periods. So like every day, you're tracking whether this happens, whether you do it, and you're tracking how much you do it. Okay, the other thing you're tracking is where the situation, so that's all the where were you, when was it, with what, that kind of a thing, what was going on at the time, so externally, and then also the feelings, the thoughts, the urges that you had before you were pulling, the feelings that you had after. And when this says after, this doesn't mean like after you're completely done or after you move on to another activity, but even after like the first second, like after you pull out the first hair, for example, after you crack your knuckles the first time, after you, pick the first piece of skin, how does it start to feel? And what thoughts are you having? And then also, later after you're done, and then maybe the next day as you see if there's any visual kind of consequences that you notice because of it. So those are going to be important things to track. Now, the reason that it's important to track the amount is because this is not behavior that's just going to go away overnight. You're not going to just say the first thing that you try in terms of like, the first thing is like antecedent control. So you notice that you're picking in the bathroom, and so you decide that you're going to put a limit on how long you're in the bathroom. And it's not just gonna be like, okay, that goes away, right? So it's important to understand, did it work to some degree, right? So did it go from, I was pulling 20 minutes a day, now I'm down to pulling 5 minutes a day. Okay, I'm still pulling, but if I'm taking more of this detail, I realize that I'm pulling less, and so I need to keep at it, keep at these strategies, rather than going a week and thinking at day 7, I'm still pulling some, so this must not be working. It's gonna be a little bit of a process, most likely. I mean, maybe not, it could be, you know, night and day, and that would be wonderful, but I don't expect that, you know. So keeping track of it helps you know if you're making progress. If what you're doing seems to be helpful, maybe you need to enhance it or add to it, or it doesn't seem to be helpful and you need to try a different strategy. So here's one of the reasons why I use the term antecedent, even though it's not like, you know, it's a little bit above the newspaper vocabulary or whatever. So because there is a little bit of a mnemonic for thinking about what are called the ABCs of behavior, because it's ABCs, like it's the foundation when we think of like behavioral therapy, okay? And it also, right, happens to stand for these different words. So the most important features when we talk about a behavior are the antecedents. So that's what happens before, and it's the context, the setting, right, that we were just talking about. The behavior, so not just, again, hair pulling, certainly not like having a bad attitude, which is not really related to this so much, but you know, people will say that was the behavior, right? But specific actions that you took. So let me give you an example. I reached up to the top of my head and I felt around and I noticed feeling a hair that felt different. It was coarser or rougher. And I felt around until I could feel the sort of the follicle of that hair and rubbed it and felt a sort of a rough, scratchy sensation. And then I twirled that hair with my index finger very tightly, maybe 5 or 6 times I twirled it around, and then gave one yank and it didn't come out. And so then I found the hair again and twirled it and gave it another yank. I pulled it out. I looked at it. I noticed the follicle had come out with it and sort of inspected the follicle and how it looks different than the rest of the hair, pulled the follicle off with my left hand, discarded it, then discarded the rest of the hair with my right hand. So you see how specific that is? That's what we want you to think about. What does it look like when I do it? Because if you're doing that, you're going to be more aware. So if you have instances where it's kind of like automatic, you're doing it, you don't even realize you've been doing it until like 5 minutes in, the greater awareness you have for this, how it starts, how it goes, what kind of the signals are, you're going to be more likely to say, whoa, 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 I'm about to start pulling a whole bunch. I'm about to start picking a whole bunch. I don't want to do that. And it gives you better ideas for what can you do as a replacement behavior. All of those things, I had some sensation in there, right? I had visuals, and I could do other things that might replace it that we're going to talk about later. And the consequences would be, most of the time for this, it's kind of how it makes you feel, and you know, how your thoughts change about it. And there's consequences. When we talk about consequences, we talk about immediate and more long-term. And I mean that on a very sort of short trajectory compared to other things. So let me explain what I mean. If I am pulling that hair, at first, I might feel kind of like good or kind of satisfied that I was able to like pull the hair out, that it actually came out, because the first time it didn't, right? And I may sort of think it's really interesting to look at the follicle, and it may feel kind of good to pull it off. All of those are like immediate consequences. Later, after I did this with like 10 hairs, I feel guilty and I feel anxious that there's going to be a bald spot, or I'm going to keep doing this. I feel bad about it. So at first, I felt kind of good. Maybe it was really mild and I didn't even notice it until I started paying attention to it. Later, I felt terrible about myself and horribly guilty. Well, I felt good right away. And even though it might not have been as intense of a consequence as, you know, the degree of it was not as high, because it was immediate, it had a bigger impact. I was more likely to keep pulling versus that bigger consequence, but that happens even just a couple minutes later. So immediacy with consequences is really important. A lot of times it's more important than sort of the severity of the consequence. So knowing that's really important. First of all, it's important to, again, take away some shame if you feel like, why do I keep doing this when it's such a stupid thing to do, and why do I do this? There's this immediate consequence that is rewarding. It's reinforcing, like saying good job to a kid, like reinforces the behavior, makes it more likely. That happens, and even though you feel bad about it later, because it is a little bit later, sometimes that doesn't impact the brain as much. So that's important just to understand and to take, again, the blame off of you. Say we need some particular strategies because this is ingrained and this is happening in a way that behaviors that happen as habits happen. This is how they form for everybody. The second reason this is important is because if we know the kinds of emotions that seem to be important, that seem to be what we're trying to get out of doing this behavior, then we can replace the behavior with something else that doesn't have the same long-term consequences, right? But it has similar short-term, maybe even if it's not as effective, but it's somewhat effective, like using nicotine gum. Most smokers will tell you the nicotine gum, that does not feel nearly as good as smoking, but it gets some of the urge. It reduces some of the urge because it fulfills some of what is accomplished by smoking. And so it might make it a little bit easier for them to then resist the urge, right? And, so we can do some of those things, and we can also just put in mind earlier, like knowing that this consequence is why I do it, imagining what the longer term consequence is going to be and putting it in our mind and saying, now I know if I do this, how it's going to feel like relief at first, but then later I'm going to feel terrible about it. And I might even imagine like the bald spot I might have or the scar I might have. That can sometimes reduce, like help us, again, resist the urge better. So we're putting that in mind and we're making that consequence more immediate in like an imagined way, which can work sometimes in our brain that way. So again, antecedent control, talking about what comes before. This is all about reducing the temptation or making it easier to resist the temptation by making things a little bit harder and doing it in a simple way that sometimes doesn't even seem like you think, well, that's not going to work. I'll still do it. It's just a couple of extra steps. But sometimes even taking a couple of extra steps can be effective. So the example here in that picture is, if you just start a diet, like a low carb diet, or you're just trying to cut calories, you may throw away everything in your pantry, everything in your house that is the junk food that you don't want to be eating, right? Now you could still go right across the street to the bodega and get that same food, but you're less likely to do that than you are to eat it when it's staring you in the face whenever you open your fridge, right? And so just by making it a little bit harder, we may not completely eliminate, a cheat for, I couldn't, I couldn't resist and I had some Oreos, but we may really reduce the amount of the junk food that you're eating, and so you still lose weight. So it's the same thing here. So examples of this are, I mentioned this before, not spending a ton of time in the bathroom inspecting and visualizing, putting like a time limit or saying I'm only going to go to the bathroom to brush my teeth and use, the restroom, and that's it. Or putting like a curtain or shade over the mirror, so that I have to consciously make an effort to look at the mirror, because looking at the mirror is something that triggers me to kind of do this. Throwing away tweezers if you tend to use tweezers to pull. Or if you don't want to throw them away, you might keep them someplace out of the bathroom in a storage container that goes under your bed behind another container. So if you really need them, you can get to them, but it's a little bit more difficult, and it makes resisting the urge a little bit easier, even if it's not impossible. So for hair, wearing a hat or wearing your hair up if you usually pull when it's down. And so maybe you don't have to wear your hair up all the time or wear a hat all the time, but if you tend to pull at home in the evening with your hair down, putting your hair up or putting a hat on, and especially if you pull from like the top of your head, putting a hat on, in order to pull from the top of the head, you have to take the hat off, right? So again, it adds an extra step and it makes you more conscious, because you might go to pull your hair and then there's a hat there and you're like, oh crap, I was about to start pulling my hair. Or if you're picking skin on your arms, wearing long sleeves, or on your legs, wearing pants or pajama pants instead of wearing just shorts or something when you're at home. Putting lotion on, or Band-Aids, or gloves. Well, gloves is sort of like the hat thing, right? If for biting nails. Putting lotion on can make your skin feel different. And so you might not want to do it as much, because the feeling of feeling around on your skin is kind of a trigger for you. So if it feels different, because now it feels all lotiony, then you don't want to do it as much. If you get a really, so if you put if you put fake nails or clip-on nails over your nails, you can't bite your nails. And most people that bite their nails don't tend to bite clip-on nails because it feels very different. The texture is totally different, and you can't really bite off pieces as easily. So people won't want to do that. So that can be helpful. But also sometimes just getting a really nice manicure, or with hair, getting a really nice like hairstyle, with gel or something, it's blow dried or whatever, so that you don't want to touch it, and mess it up. And you're kind of, is an extra motivation, that can be a helpful antecedent strategy. For nail biting, there's also stuff, right? No Bite and Stop, I think, are two sort of brand names, but where you put it on your nails and it tastes really bad if you try to bite your nails. So, any of these strategies, these are all just examples. And I think the really thing is your situation can be unique. So you got to think about, what is your sequence? What do you almost always do? Or maybe you have 3 or 4 different kinds of situations, but in one situation, what does it tend to look like? And then if we sort of break that chain up a little bit, we can make it less likely that you're going to do the behavior as much. So it can be helpful. Replacement behavior. So this is, again, when we know the consequence, when we know how it feels to do it, then we can replace it with something else. So sometimes if it's just about feeling nervous, or if it's about feeling restless or bored, it could be something like a stress ball, or slime, or another sort of fidget, something to do with your hands, knitting, or something like that, right? Silly putty can be helpful. If it's something to do with the texture and the way it feels, something that feels kind of good or similar. A lot of times it might be rough items. So you can get different fidgets, different sensory wearables and sensory toys that they're often called that, that can be helpful. Some things that have spiky stuff or rough bits can be, a lot of people like those, are koosh balls. Things like that are things that sometimes people say, helps them. So those are, replacement behaviors, functional replacements. They serve the same function, the same purpose as the body-focused repetitive behavior, right? But without the consequences. So they can be really helpful. Now, if you're having difficulty really finding anything that gives you a similar feeling, the other thing you can think about is what's called habit reversal, using a competing response. So this is basically the same thing as a replacement behavior, except we know the behavior isn't going to satisfy the urge. But it's something that I do, and I can't both be doing this behavior and at the same time doing the other thing. So if I'm knitting, I wrote that on there, but knitting doesn't feel anything like pulling my hair. But I can't knit and pull my hair at the same time. While I'm knitting, I need both of my hands, right? So therefore, I can't use a hand to pull hair. So, but it could also just be sitting on your hands, as simple as that. But doing something that you can't do it and the behavior at the same time, and then noticing the urge and tolerating it until that urge is probably going to get worse and worse and worse, and then it's probably going to go away. And so we sort of sit there until it goes away, or if it's a really fast urge that goes away quickly, continuing to do that behavior for about a minute, just so we do it long enough, because this is actually going to kind of train our brain that when I have this urge, when I have these feelings to do this behavior, I actually don't have to. Nothing bad happens if I don't do it. Then I also feel good. I feel proud of myself for being able to resist. And this can teach the brain that and can kind of reverse it. But this can be very, very challenging. And it's ideal in most situations to find something that at least gives a little bit of a functional replacement, at least, feels a little bit similar, or has a similar emotional effect as the body focused repetitive behavior. So mindfulness, again, I'm kind of going quickly because I see the time. This is something that people may be aware of. I'm not going to go into it in as much of a detail because it's sort of broad and you could do a whole hour talk on mindfulness. But mindfulness, the idea is increasing your mindful awareness. So this can help you be more aware of the pulling when it happens, which can be important because, like I said, sometimes it's automatic. It can also make you better able to sort of resist urges and have urges and thoughts and emotions that come up, but you don't feel like you have to act on it or that those things control you. You can feel like they're a wave kind of crashing and then going away, or a cloud slipping away, right? So getting into a mindfulness practice can be helpful. And it can be, you can do meditation, you can do yoga or some like a mind-body practice like that, but it doesn't have to be that. You can do a simple exercise of just listening, closing your eyes or putting your eyes on a fixed, uninteresting place for a few minutes while you're sitting still and, but, comfortable, but relatively, straight kind of position so that you can breathe well. And just listening to the different sounds that you might hear around you without judging the sounds, without trying to identify what the sounds are, just sort of listening and observing. You could do that, or just a breathing, focusing on what it feels like in your body when you breathe without trying to change your breath for like 5 minutes a day. And that can be helpful to increase your mindfulness. Just shutting off the TV when you eat and just eating. And it doesn't have to be the whole meal. It could just be for 5 minutes of the meal, just eating and focusing on what the food feels like in your mouth and tastes like. And of course, there are different apps. There are different tools and resources for mindfulness. I'm not going to go into them, but if someone is really interested and they have a question, I can answer that. But this can help. Like I said, it's not a treatment in of itself, but it can enhance the treatment for this. Okay, along with those other things. And like I said, monitoring the pulling and writing it down, that's a form of mindfulness in a way. And so it can make you better at that by practicing mindfulness in other ways. Okay, so when do you seek professional treatment? So if there's a lot of noticeable damage because of this, like you really have visible bald spots, or they would be visible unless you wear your hair a particular way to cover it, or obvious scarring, again, that other people either would notice, like they do notice, or they only don't notice because you spend time like putting makeup on it or something, so that, or wearing things that cover it up always consistently so people don't notice it. This is going to be hard to treat on your own, and you really may benefit from professional treatment. If it really significantly interferes in your life to the degree that you feel like this is something that's keeping you from being happy, this is something that's really making you miserable, right? Really depressed, really anxious about these behaviors, you're spending a lot of time thinking about it, it may be really hard to just tackle this on your own, and it's okay, that support can be helpful. The biggest thing I want to say now, because you're coming to this or you're interested in this, if you say, I'm going to try these things that Dr. Benson was talking about, it seems like maybe he knows what he's talking about. And you try these things and I don't mean like 2 days or 3 days, okay? I said it was going to take time and there's a little trial and error. But let's say a few weeks go by and you just haven't been able to make any progress, then that's not a sign that these things don't work. I mean, it's possible that these things won't be as effective for you. I can't guarantee that these things will work for everybody. But it's more likely that it's really challenging for you to do this. And the devil can be in the details. So the principles will work for you, but there's something about it that, you know, is difficult for you to kind of see or do. And the support of having somebody who's an expert that can really help you out with this is needed to get the full benefit of these kinds of techniques. Now, you should seek immediate medical attention. Like I said earlier, if it's self-injury, that's really important. Also, if you're having suicidal thoughts and urges, which sometimes can be more common in people who experience these behaviors, if they're experiencing it to a really high degree versus just the general population. So if you're experiencing that, better safe than sorry, really want to seek medical attention. Certainly, if you were highly concerned that you might do something to hurt yourself immediately, you want to call 911. That's really important to treat that as an emergency. But if you've been having thoughts like maybe I don't want to live anymore or something like that, you may not need to call 911 and go to the emergency room right now, but it is something that you really want to have treated to make sure that doesn't get worse. So you want to seek immediate medical attention. So if you have a referral to a therapist, great. Certainly you could call our office, but you might also talk to like a doctor you trust, like a primary care provider, or a doctor that you go to regularly who could give you a referral. And the other important thing is if you pull your hair and you are eating the hair, if you're ingesting it, you really need medical attention for this because it can actually block your digestive system, and in the worst cases, it can be fatal. Cats, obviously, when they lick their hair right and everything, they get hair in their stomach and they're able to form hairballs that they cough up. Humans actually don't have that ability. We actually do not have the system that cats have to create hairballs. So all that hair can just get stuck in the stomach and lodged there. So it can be fairly common. Most people who pull their hair don't eat it, but it's not totally uncommon either, and it can be hard to change. You really want to make sure you see a doctor and that you're monitored medically because, of course, again, safety is number one priority. Now, what should effective treatment look like? I'm doing okay on time, although I'm not going to have a ton of time for questions, but like I said, I'll stay over for questions. So this treatment should look pretty similar to the kind of stuff I talked about, okay? That's the kind of treatment that has been studied and where we know it can be helpful in really reducing this behavior. In some people, totally eliminating, and most people reducing significantly, so it's not as big of a problem. So it should be behavioral, right? It should have the ABCs of behaviors, and you should be looking at the specifics for you. So CBT, cognitive behavioral therapy, and DBT are both therapies that there's ways that these treatments have been adapted to also treat this behavior. ACT, something called ACT, which is acceptance and commitment therapy. That's another form of behavioral therapy. It has also been adapted to treat this. So providers who provide that are good starting points. Those are good search terms to use. Those are good things to ask. Do you know people who do behavioral therapy, CBT, DBT, ACT? And then you can ask those providers how much experience they have with these behaviors. You may also have anxiety and depression, like I said, that you want treated. Like I said, that's not the primary thing for getting rid of these behaviors, but they can co-occur, right? And so you may want that, which can also be treated with therapy, and those things can be treated to some degree with medication as well. But as I said, I alluded to this earlier, there is no medication that has been shown to reduce these kinds of behaviors on their own. So sometimes if you go to a doctor, your regular doctor or a psychiatrist, they could prescribe an antidepressant, even if you're not really feeling depressed, but you're feeling this. Sometimes we'll see that, and it's because if medication is the way that they treat things, that may be the best thing that they have, but it's not likely to be very effective. Therapy really is the key treatment in using these techniques that we've talked about. But like I said, medication can be helpful if you're also experiencing anxiety or depression or OCD, which can co-occur with this. And so those medications might be part of helping you effectively. But for really specifically reducing these things, the key is this type of behavioral therapy. Okay, so here are some of the resources. So the first one So you'll see it says it's ACT enhanced. It uses some elements from ACT to enhance kind of the way that the mindfulness enhanced. So it has the key features we talked about. Then there's some other stuff that's specific to ACT that's added on. There's a therapist manual for this, but there's also what's called the workbook, the client workbook for this. And it specifically says it's for trichotillomania, which I mentioned earlier, that's hair pulling. However, you could use a lot of these same techniques if you're skin picking, if you're biting your nails, you could use these same techniques, right? And that's where that monitoring form came from. The other book that I recommend is also, again, kind of specific to hair pulling, but the techniques work really well. You just have to get around that a lot of the examples are more hair pulling examples. That's by Fred Penzel. It's The Hair Pulling Problem, A Complete Guide. Has a lot of good information in there that is beyond what I could cover in an hour. I will say if there are any parents on whose kids are on there, I didn't mention a lot of stuff specific to kids, but if you do, the key for that is the parents are going to be the ones that are monitoring. The parents are going to be the ones who figure out the situations where it happens, if they're younger kids, right? And the parents are going to be the ones that have them wear hats, that put the bad tasting stuff on the nails, you know, so that they don't want to chew the nails, things like that. And then the other thing that parents want to make sure to do is not to punish the child for doing these behaviors, because they're not doing it on purpose and they can't control it. And then also to reward them when they use, if you might, for a child who's like school age, you know, 10, 11, they might be able to have their own replacement behaviors that you help them come up with. They have a stress ball that they like that's, you know, and you can praise them for using it and also give them rewards. Like every time you see that they're using their stress ball, they get some points, and with enough points, you know, they can have some extra screen time or a piece of candy or do some special activity or something like that. So I just wanted to throw that in there, but the principles are the same. Okay, I answered the questions that have come up so far. It is 1:02 now, so I talked for exactly an hour. You know, this will be recorded if you have to go, but I'm curious if anyone else has any other questions. I'm going to stick around. Please put them in the chat. If you have any difficulty or disability or something wrong with your keyboard, or just difficulty kind of phrasing yourself as well in writing as you can in speaking, anything or like that, you can definitely raise your hand, or you know, just say in the chat, hey, Q, or I have a question or something, and I can unmute you. Or you might be able to unmute yourself right now, if that's the only. How can we view the recording? Great question. So in terms of the recording, I'm not sure the exact answer to that. I think we will make the recording available at different times in the future. Hopefully on our website, which is cbtdbtassociates.com. I did notice when I was looking at some of the other webinars that we've done, that some of my colleagues have done, that the recordings are not up there. At least I didn't find them up there when I looked, and I did ask a couple of the people who are involved with planning these webinars and getting these things together, if and how we would be making the recordings available. However, I've not gotten an answer. So I will follow up with them, and since I have the emails of everybody who is registered, if I get a quick answer, might be able to send out an email to everybody to say, you know, to give that information about the recording. But right now, I'm not exactly sure when it will be available. You can also email me if you want the recording, or call our office. Whoops, I didn't go to that. Here's the slide with my email. Sorry about that. So this has my email. It's benson@cbtdbtassociates.com. It's a little bit of a weird email. So the slides will be sent to you. So that'll be helpful because you could like copy paste. But just pay attention to the fact that it's not the whole word associates. It's ASSOCS. Okay. I'm looking at a question. Aha, so I have a question about a student who's doing this in class. and the classmates are concerned about the behavior and maybe disturbed by it. So this is a really tough issue. So the person posting this is a school psychologist, which is great because you're able to maybe see the student individually, pull the student out of class maybe more easily than a teacher, or now that, you know, I know things are virtual to some degree, that, you know, how that affects things. But, you know, this may be something that you really want to talk to the parents of that student about, not so much because other kids are bothered by it, but because it is something that is difficult to change. And you may want to talk to this student about it. Like, maybe, is the student aware that they're doing it? You may say you just observed it when you were coming into the class, or you may come and observe the class first before you pull the student out. And so you observed it, and ask them if they're aware of it, ask them if it bothers them. You know, try to figure out if there's any reason that they might want to change it. If you could work with them on this, if you felt comfortable doing that, that could be great, especially if they're only doing it in school. But they may also be doing it at home, so it's a good thing to talk about with the parents. I think with other kids, it's more challenging, right? And we get into those like more anti-bullying, anti-harassment types of strategies with kids, that everybody's different. One thing that I think is really important to think about is that everybody has habits to, you know, of some degree, to some extent, right? You know, and they're hard not to do. So other kids may identify with something else, like that they, you know, scratch or pick at, or maybe they've picked their nose in the past or something like that, you know, and they find it difficult, and it's like that. And yeah, they're not grossed out by that behavior, but it's a similar thing. Other people might be grossed out by it or whatever, but it's just something that we all kind of have to understand, that different people do different things and have difficulty controlling. That's kind of my best answer for that. Hopefully it was helpful, but that is definitely a challenge when you see that at school and you're not sure like how it's being addressed, and you have like other students that might be commenting on it, right? One thing I do say, if one kid is doing something and everybody else in the class, or like a lot of other people in the class are doing, are like making fun of it, what is a pet peeve of mine is when somebody says, now, some, you know, does a presentation to the class, some kids may do something such as, and you try to like dance around it, but the kid obviously knows you're talking about them. That can be really embarrassing for the kid, and they might feel shame. So I like to talk to the child about it, and, you know, and ask the child, like, have people made comments? And if they have, and the child doesn't like that, you know, if you can direct, you know, again, address it head on with a certain group of students, and it may not be with the whole class, maybe in a private situation or one-on-one with a few people who are having the most problems, but where you talk about that we all have habits, that we all have things, that it's important. Can you just distract? Can you look at something else or whatever, and try not to like judge that kid, and, you know, on a developmental level. So someone asked where they can get the slides. The slides are going to be emailed to everybody who attended. Maybe not immediately afterwards, hopefully soon, within the next couple of days. And so they should be emailed, probably not by me. They'll probably be emailed by a colleague. But if you don't get the email with the slides after like next week, like it's mid next week, shoot me an email and I will follow up and make sure they're sent to everyone, but I can also just directly send them to you as well. Okay. Any other final questions? Otherwise, I'm going to log off. But like I said, if you have questions that you didn't feel comfortable bringing up, please feel free to email me now that I have my email up there. And like I said, it will be in the slides that get sent to you. But Benson at CBT DBT.com. Make sure that you don't put out the full word associates, and that you understand exactly what the abbreviation is, and you wrote it correctly and legibly, because people get my email wrong all the time. It's can sometimes be confusing. All right, thanks everyone for attending. Really hope this was helpful. I've heard some thank yous, which I appreciate, and you're very welcome. It was my pleasure to do this, and I just hope that you all can benefit from it. So take care, everybody. Have a great rest of your day. Have a great weekend, and stay safe, everyone, and stay healthy during these crazy, uncertain times that we're having. All right. Bye-bye, everyone.